This video is meant to help teens with eating disorders. Our group consisted of Ruhani, Jackson, Vivek, Marshall, and Jody. Marshall researched the steps to take if you think you might have an eating disorder.
The first thing to do if you think you have an eating disorder is to examine the changes in eating habits and appearance, and if there is a significant physical or mental change, then you should consult a professional such as a counselor or therapist.
In many cases for the parent or the mother, you have to strive for perfection. That kind of sometimes leads to distorted body image. It's not a perfect body. It's not going to focus on being a body image. You're dealing with it. That way, you're not dealing with the underlying issues.
Vivek found some common causes of eating disorders.
An individual may feel insecure about their body weight and may feel as if their body is too large. They stop eating and greatly limit the amount of food they eat, even when they become underweight.
So if their body image is shot, ask are they eating or not eating? Are they withholding food for themselves? Are they constantly looking themselves in the mirror? Are they using food, going to the bathroom, purging?
Rue researched the success rate and factors involving success in patients undergoing therapy for eating disorders.
The success rate of therapy and treatments is really dependent on the commitment of the patient and the people supporting the patient. For adolescents, treatment can have a lower success rate because of the tendency to not trust their counselor or therapist.
If you catch it early enough, it could be a pretty high rate of success. If they focus on, once they get the eating regulated properly, getting underneath the underlying issues that lead to that, which are usually like self-esteem issues, those are post-traumatic stress from, like abuse, particularly sexual abuse.
Jody researched the 3 main types of eating disorders.
The most common types of eating disorders are anorexia, bulimia, and binge eating disorder.
So there's 3 main, anorexia nervosa is one, bulimia nervosa is the other, and then binge eating. So, and anorexia is people not eating, not eating enough or not eating regular, where you see the weight loss. That's the biggest one. Bulimia is a little bit different. That's where you go ahead and eat and then purge. So you'll see the fluctuation in weight, or you'll see the weight loss. And then binge eating is just, eating too much at one time. So you'll see people's weight fluctuate, go up and down because of the binging that they're doing, and that's eating, too much at one time and maybe not eating for a few days and then doing the same thing. So you'll see the fluctuation in weight with people that have these 3 disorders.
I looked at signs of recovery and successful treatment, and this is the summary of my research. When a person is back to normal, their BMI will be a normal range, and the general feelings of anxiety and depression associated with eating disorders will be gone. A person who has recovered will also feel more confident about their body.
That you can maintain and you're healthy with. That's when you start to realize that you're recovering. Once you do that, your energy will come back. You'll go ahead and be able to, get involved in more athletics and more physical stuff. But you should also see, mood changes, where you're more positive, maybe not as lethargic as you were, and basically being more social, being just a normal kid. Being a kid's hard enough. With a disorder, it's just that much harder for kids.